Hi everyone, it's Dr. Rich Salvatore from Salvatore Dental. We get a lot of questions about dentures, so I'm here to answer any of those most commonly asked questions to give you a little bit more information about dentures. So some people want to know, what exactly are dentures? So dentures are a way to replace your teeth. So some people unfortunately lose all their teeth or already are missing their teeth. So kind of an economical and an old school approach to replace teeth is with a denture. It's basically a piece of acrylic with all the teeth. It slides into your mouth on the top or the bottom, and on the top we can actually get a little bit of suction. So imagine kind of like a suction cup on the top with teeth attached. A lot of times we can get some good functionality out of it. They look great, and thankfully, it's a very good alternative for some patients. So some patients question on what kind of dental professional offers dentures. Usually it's just a general dentist, such as here. So we do dentures here. Believe it or not, I'm third generation. My grandfather did a lot of dentures back in the day. Not quite as old as George Washington with the wooden teeth, but pretty close. So it's very similar. The cool thing now is that we have ways to do dentures that are different. It's not the older school approach. We can use some scanning, 3D printing. We can fabricate dentures very quickly, and using all the kind of the cool technology to make sure that it looks really good and it fits awesome. So dentists usually recommend getting dentures when unfortunately the teeth are not salvageable, meaning if we've got some teeth that are breaking down, gum disease, big cavities and things, then it's usually time to go towards a denture situation. Our point of view is when your teeth become a liability more than an asset. If there's only a few left, sometimes it's better approach to look at everything and do something like a full denture to replace your teeth. So some people wonder what type of dentures are available. There's a couple different kinds where there's full dentures where all the teeth are missing and it's full because it completely replaces all the teeth. There's also partial dentures. So partial dentures is when they're partially replacing teeth. So you have some teeth that are stable and healthy, and then we have some partial that can go and slip into the area to replace those teeth. Thankfully now we have implants, so we have some dentures that we can have implants placed where now the dentures will snap on and stay in really, really well. And then we can go over to my favorite portion, which are dentures or bridges that stay in place by screwing down into implants. A lot of patients ask how are dentures made and what kind of materials are being used for them. So the older approach is some dentures are used kind of making like an acrylic, which is more or less a plastic. Pretty long lasting, nice and lightweight. Now we can switch over to doing something similar using some 3D printing technology. They look a little bit nicer and more realistic, and the turnaround time is quicker. When we move over towards partial dentures, some of them do have some metal in them to kind of grab onto the teeth, and then we put teeth around those. So you see some people with some metal on them for stability, sometimes not the most aesthetic. And then we can move towards implant dentures where they're made out of a stronger material. It's called zirconia. It's a very, very strong material. It's almost like it's as hard as a rock. They stay in and they're very stable. So patients often ask, is the process of getting dentures painful? The answer is, it depends kind of where you are in the process. So sometimes when we get dentures, if they're immediate dentures, meaning some teeth do need to be removed, we do have to give you dentures right away. So some of the discomfort can come from the surgery. But what we do here is when we have to give you teeth right away, we take the teeth out and we give you teeth right away, which are dentures, kind of like a Band-Aid or healing denture. And that actually assists in healing. So if you have teeth out and you do nothing, it's kind of open to the environment. If you have teeth out and you have a denture placed, a Band-Aid denture, it goes over the area and kind of protects it and helps the healing. So I actually see patients that do better with healing when we place something immediately right away. Other times, when patients are already missing teeth, having a new set of dentures, there's literally zero pain at all. So oftentimes patients ask what kind of anesthesia options are available during a denture procedure or a denture surgery. The answer is we can go all the way from a patient being awake with just Novocaine, or we can go all the way to having an anesthesiologist where you're asleep. So and anywhere in between. Here we know how the dentist can be, kind of anxiety for some patients and they don't feel comfortable. And a lot of times that's one of the main reasons why patients don't come. So we have really good options for sedation. Some of my old school patients, just a little bit of Novocaine, we're good. Other people want to be snoring. Patients often ask, what should I expect my dentures to look and feel like? Ideally, we want your dentures to look as close to your natural teeth, if you had nice natural teeth, as possible. If not, a really nice natural smile. We try to stay away from like the chiclet or movie star white toilet bowl white kind of thing. We like to have a natural smile here. The feel of them can be different depending on the option. If we go towards the regular denture where it goes over the roof of the mouth and is with suction, there is a little bit of getting used to that will take. The roof of the mouth is covered in things. But if we go towards an implant denture where the implants are placed and there's no roof of the mouth, that's much easier to get used to and more realistic feeling. We get many questions on maintenance and how to clean and care for your dentures. Daily maintenance is the best. So if they're removable dentures that come in and out of your mouth, we say just to go underneath at nighttime with a toothbrush and a little bit of warm water. We actually don't recommend using toothpaste on your dentures because over years, and we expect your dentures to last years, that toothpaste can actually wear them down. So just a little bit of water, and then we do soak them in a denture solution to just make sure there's no bacteria or anything like that. If we have dentures that are fixed and stay in with implants, then simply we brush normal and we use a water pick. Patients ask, will my dentures affect my ability to eat and drink regularly? It's kind of dependent on the option. So the full denture option, it's great, it's more economical, but there is some alterations with eating and drinking. I often see that the patients, because the roof of the mouth is covered, there's a little difference with taste. There's actually taste buds on top, and the temperature sensation is different, drinking coffee, having ice cream, that kind of thing. Also, when we have teeth that come in and out, your biting power is significantly reduced, so it's harder to chew through steak, chicken, this kind of thing. So my denture patients tend to go to something that's a little bit easier and more tender. I say you can't order a cheap steak, you have to get something nice like filet mignon. But then if we go for the better denture, which is like an implant one that are very stable, made out of the stronger zirconia, we literally can eat anything, corn on the cob, cheap steak, expensive steak, chicken, whatever you like. So we try to go towards that option. It's the best option, but we do whatever is needed. Patients often ask, what kind of special care do I need to take for my mouth and gums after dentures? It's pretty similar to anything else. If you have removable dentures that come out at nighttime, we take the dentures out, we clean them, and then we want to make sure that your mouth is also clean. So I recommend, brushing the remaining teeth at the remaining teeth, using some Listerine, and just making sure everything's nice and healthy. And I actually do recommend not sleeping with the removable dentures in your mouth, letting the tissue breathe. Sometimes patients don't listen to me. That's okay. If you have teeth that stay in permanently, like the implant dentures, then the gums and tissue are a lot happier. There's nothing that lays on them and moves around. And that one's just brushing and water picking normally. Patients often wonder, how long will dentures last? And that's kind of dependent on which denture option. So if we have a denture that's a full denture made out of acrylic, they usually last maybe 5 to 10 to 15 years. It's an acrylic material, so it does tend to wear down. It's kind of based on, if you're a big, burly 300-pound guy, you might chew through them or wear them down quicker than a 90-pound female. So that's kind of dependent. Also, with dentures that come in and out, the bone underneath does change, so they tend to start to be ill-fitting after a few years and require maintenance. If we're going towards something with implants where they're fixed and they stay in place, thankfully, there's not as much change in the gums. Everything stays because the implants are in, and the material is stronger than the plastic. So the implant dentures, if taken care of, should be indefinite. Patients think about, what if my dentures need replacement or repair? The good news here is that we do have 2 ways to repair things. One would be in-house. We have a lot of abilities here to repair a broken denture, a broken tooth, and we have an outsourced lab that's local, really, really great service, overnight service. So if patients have problems with their new dentures or old dentures, then I always encourage them to come in, and we have the ability to fix them. So patients ask, how long will it take my mouth to heal and get used to dentures? It's kind of different depending on each situation. If it's only 1 or 2 teeth coming out and a full denture goes in, then it's a little bit easier because there's not as much healing. But if you have a whole mouth with 28 teeth and all the teeth are coming out, we're putting dentures in right away, it will take a little bit longer. Those patients could take up to a week or 2 to get used to them. The way that we do things here, if it's a bigger surgery, we make you a Band-Aid denture, so it's set right after the surgery. And then after 3 months of healing, we go and make you the final set after the gum and the tissues all healed nicely. So patients wonder about the cost of dentures and if insurance will help. So oftentimes dental insurance will help with dentures, but it's kind of case dependent, and there's all these rules that they come up with if they're going to be covered or not, and the missing tooth clause, and there's a million different variables. So what I encourage my patients to do is to come in, have a free consult with us. We'll kind of go over everything, including the insurance questions, and make sure that you get a good set of dentures that you're happy with. I hope I've been able to answer some questions you've had regarding dentures. And if there's any additional questions, or if you'd like to make an appointment, feel free to call us at 518-899-6068. We're here to help.